Let's move on to our next story. Crippling staff and equipment shortages have reportedly left babies at death's doors in the Dora Nginza Hospital in Gqeberha. Daily Maverick reports that the infant death rate at the facility has skyrocketed since last year. The hospital's neonatal unit has run out of bed capacity, meaning that babies may not have access to high care services. For more on this, we're joined by Daily Maverick journalist Estelle Ellis. Estelle, thank you so much for joining us this morning. It's a dire situation at many of the country's health facilities. What's happening at this particular facility, the Dora Nginza Hospital?
Yes, indeed. Thank you very much. Dora Nginza Hospital is the center for pediatric care for this region, the Nelson Mandela Bay region. And so the sick babies go there, and then they also look after the preemie babies and also the preemie babies and the sick babies from the larger Karoo area. So they serve a lot of people, and they have not had a lot of posts filled in the past 4 years. They also, because of the birth rate that had increased, there wasn't, that unit has not expanded. So they are completely overcrowded, and they've had a few hospital-acquired infections that broke out because of the unit being overcrowded. And then the last and the biggest problem is that they have a dire shortage of nurses as well.
Now, what has the Provincial Health Department said about the crisis, Estelle?
So the MEC for Health has admitted that there is a huge crisis, that the unit is overcrowded and understaffed. We have received information after the story was published that they will have indicated that they will fill 48 nursing posts for the unit, which would be really great news. But we'll follow up on that. And but yes, the MEC for Health, she has admitted that there is indeed a problem.
Have they given any timeline as to when those changes will come into play? Because there are people who are in dire need of healthcare, and just saying that you're going to increase the staff contingent isn't enough. What's the timeline?
Yes, no, we haven't received a timeline yet. Of course, the leadership is a little bit in flux at the moment at the Eastern Cape Health Department. Dr. Sibongile Zungu was sent here by Minister of Health, Zweli Mkhize. She's been recalled back to the National Department, so we now have an acting SG, and that unit also falls under a hospital that only has an acting CEO, and has had an acting CEO for almost 3 or close to 4 years now. So timelines are in short supply in this province when it comes to health, but we're hoping that it will happen fast.
Well, Estelle, thank you so much for bringing this story to our attention, for being part of the people who brought it to our attention. And hopefully, now that it's out in the public domain, something will be done about it. That was Daily Maverick journalist Estelle Ellis joining.